Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, duodenal ulcer and treatment of complications. So, what are the complications of duodenal ulcers and how do we treat it? So, whenever there is intractable duodenal ulcers, only duodenal ulcers, they are treated by highly selective vagotomy. Then, second, if there is bleeding in the duodenal ulcers, then first you will have to repair the vessel, that is gastroduodenal artery should be sutured, that is you should suture the or ligate the gastroduodenal artery, and then it is suture. You should suture the gastroduodenal artery. Along with that, you should do a truncal vagotomy with pyloroplasty is done in case of bleeding duodenal ulcers. Then if there is perforation, if it is a perforated duodenal ulcer, then if this is the perforation, over the perforation you put an omental patch and you suture it. So omental patch repair is done per a perforation, and this is done in patients with truncal vagotomy and in stable patients. Then if there is obstruction of the gastroduodenal obstruction, like outlet obstruction. So if there is an obstruction here, if there is an ulcer causing obstruction, then if there is an obstruction, first and foremost, we should make sure and we should rule out malignancy. And after ruling out malignancy, the ideal procedure for an obstructed or gastric outlet obstruction is we can do a truncal vagotomy with anerectomy is the ideal procedure. We can also do a truncal vagotomy with gastrojejunostomy can also be done in cases of inflammation and scarring. Then, if there is intractable ulcers and there is bleeding, if there is either intractable gastric ulcer or if there is bleeding, then based on the types of the gastric ulcer, we can treat the patient. Right.
thank you and thank you for watching.